Talus, the founder of Mobility Clinic, and today we're here with Brent, who has a 14-year-old ankle injury, correct?
Yeah.
So what we're going to review today is how we use a compression wrap called RockFloss, or some other brands out there are Voodoo Floss. And what it is about a 2-inch strip of rubber that basically has an elastic band to it. And what we're going to do is basically wrap this around his ankle with active range of motion to help basically stabilize the muscle, decrease pain, improve range of motion, and flexibility. So we're going to show you how to do it, walk you through the steps and kind of ranges of motion on Brent's ankle. So, all right, Brent, let's come on and sit on your back face up. So give me your ankle down here for me. Now this also comes in a 4-inch strip where we can do anywhere from your thigh all the way into your calf, things like that. So we both have both the 4-inch and the 2-inch. This is really easily used on any extremity, ankles, into your foot, your arch. We can do it up to your knees, your elbows, your wrists, and even up into your shoulder. So what we're going to do for Brent is he had a really bad ankle sprain back when you were in college, right?
Yep.
And basically an inversion sprain and a lot of just scar tissue and inflammation that's been holding him kind of hostage for a little while. So what we're going to do is show you kind of how to put it on, do the ranges of motion, and go through kind of how we do a RockFloss treatment. So we're going to start here. I want you to sit your foot nice and like you're standing on it, nice and flat. And the idea is about a 50%, we're going to anchor it down, about a 50% overlay of the layer above. And then you got about 100% stretch, and we're going to go about 50% stretch on it. And we're going to wrap it down. Now a lot of times you can go towards the heart. Since he's not super inflamed right now, we're just kind of dealing with a lot of old scar tissue. It should be okay, but in general, you want to start low and wrap towards the heart. So what we're going to do is get that nice little stretch around. It's going to be pretty tight.
Yep.
We're going to wrap it around his ankle, and specifically his anterior talofibular ligament, which is about right there, and that's where he's really having that sensitivity. So nice little stretch and pull. Back and forth like this. And once we get to the end, we're just going to take the last little strip and we're going to tuck it in like this. Okay, now this is where the movement comes in. So Brent, swing your legs around to the end of the table. And what we're going to do is just have you seated first, and we're just going to have you just pump your ankle up and down, back and forth. So it's going to feel a little tight. And then when I do this with patients and I give this to them to do at home and things like that, I can actually do a little myofascial release as we're going. So keep going up and down. Good. Excellent. We're working in all those muscles, your tibialis anterior, posterior, into your gastroc soleus, into his Achilles, all the muscles that overlap the ankle. Now, Brian, I want you to go up and out, down and in. So you're going to go kind of in an X pattern. So this is kind of stretching out those lateral ankle ligaments, and you can feel that.
I can feel it, yeah.
Grittiness in there from 14 years of scar tissue buildup.
It's weird because it's like pain, but it also feels good because I can tell that it's working, that it's things that need to be done.
Exactly. So we're using a lot of compression nowadays to help deal with edema and inflammation because our body works on a negative pressure system. So we need to pump that out, and the way we do that is by movement and activating our muscles. Now go the opposite direction. So you go up and in, down and out, up and in, down and out that way, up and in, down and out, perfect. Then you're going to do clockwise, counterclockwise circles for me. So just go back and forth circles, back and forth like that, perfect. Ooh, so see how his toes are kind of getting a little bit white. So we want to do it when we're starting to feel a little bit of numbness in the toes, but and then that's when you know it's time to kind of take it off. So no more than 2 minutes, maybe a minute on this until you feel kind of numbness in the toes. Go ahead and stand up for me, Brent. And you're going to go up on your toes and do some toe raises for me. Up and down. Perfect, couple of those. Good. Now I want you to go up on your heels and just kind of walk on your heels for me. Couple steps there. So there's all kinds of different motions that you can do with this one. And the next one we're going to do is kind of a Talus Glide. So the talus sits right in between the tibia and the fibula. And what we're going to do is just get that glide kind of back. So you're going to keep your heel down, and you're going to bring your knee forward as far as you can, come all the way back, almost like a lunge with the heel staying on the ground. So you're getting that glide between the talus and where the subtalar joint is. So back and forth. Excellent. Do a couple pumps there. You getting tingling in the toes yet?
Yeah, not so much the toes, but the ankle is pretty tight.
So as much range of motion as you can. And again, I'll kind of treat this area.
Oh.
Yeah, see, a little tender. Keep going. So you can even feel that just gritty tissue in there. So, all right, let's sit back down. We're going to take it off and then see how it feels. So swing your legs around. Hold your legs straight out. There you go. Go ahead and stand up, wiggle around, get that blood flow back. Now again, just to review what we're using this for, compression strap is to get that range of motion back, get you a little bit better flexibility, decrease the pain, edema, and inflammation. Okay, so we just finished with doing a RockFloss compression wrap on Brent's ankle. And he's also been having a little bit of knee pain recently. So we're going to show you how to basically do the RockFloss compression wrap on the knee. Now, Brent, the knee started a couple months ago, is that right?
Well, it's been pain on and off for about the last 8 years or so. It gets better, it gets worse, but yeah, a couple months ago it just started getting pretty bad, and then you've been treating it for about the last 2 weeks and it's gotten dramatically better.
Yeah, so we've been working on a patellofemoral kind of tracking issue with Brent, decreasing his inflammation kind of in his weak VMO, his vastus medialis of his quad, and his tight IT band. So we're going to walk you through on how to do his knee here. So for the knee, what we really want to avoid is basically doing the RockFloss over the patella. We don't want to put any pressure on there or cause more inflammation than we need to. So all we're going to do is start at the bottom here, get a little anchor going, and we're going to wrap towards his heart. Okay, so 50% overlay, again, wrapping all the way up towards his heart here, right over the patellar tendon. About 50% stretch on the RockFloss, coming up above the knee, avoiding also his back section of the knee here, all the way up this way. Okay, once you run out of the RockFloss, you're just going to basically tuck it in to the end here. Okay, Brett, go ahead and swing your legs around, and we're going to do a couple exercises here. We're just going to non-weight bearing to start, so have a seat. And you're just going to bring your knee in, flexion, extension, as far in as you can. To exhale, exhale. Extend the flex. Good. Now, a lot of times I'll do myofascial release on this as well when we do this in the office. We'll get on his posterior popliteus, which will be pretty tender. So we're just going to keep doing flexion, extension. Okay, now I want you to point your toe out, so externally rotate the tibia, and we're going to go flexion, extension as well. And we're going to get kind of on his VMO and his IT band here. Working that out right there. Good, keep it going. So again, we're going to do about no more than 2 minutes on this until he starts to feel a little tingly in his feet. Okay, now let's go internal rotation with the foot and an out for his tibia. So right in that internal, external rotation of his tibia, as well as while we're working around the structures of the knee here, working mostly the IT band is a lot of times very tight, which causes a patellofemoral tracking issue. Basically, you're tight on the lateral, weak on that medial quad muscle there, so the patella tracks laterally. So what we're trying to do is just kind of loosen up all the structures that are kind of making the patella not track properly. All right, good. Now go ahead and stand up for me. All right, now we're going to do a couple squats. Okay, so stand shoulder width apart, and I want you to go down into a nice little squat. Okay, not super deep. Bring it up and down. So you can watch his knee. A lot of times we'll watch for that kind of varus and valgus collapse of the knee. You want to keep it stable. Now, a lot of knee pain for people will come from the pelvic stability because our pelvis is not basically engaging at the glutes. So we're getting a lot of wobble in the knee, and we can see that in your squat pattern. Okay, now let's do a lunge. So you're going to lunge forward with that knee.
Okay.
Bring it straight back out like that for me. So lunge forward with the right foot. Back on up. Do about 5 or 6 of those. Great. Couple more. Excellent. Good. Now you can even hold on to me and you can do like a little single leg squat. So you can come up and down with the single leg for me. Perfect. Good. Stabilize yourself. Good. Get tired?
Yeah.
Get tingly? Okay,
Yeah,
so let's go ahead and take that off. Been about 2 minutes there. And we're just going to get that blood flow back. There we go. Go ahead and stand up for me, Brent. Back out.
Yeah.
And see how loose that feels there. So that is RockFloss compression wrap for the knee. That about does it for us. Thanks so much, Brent.
Yeah, thanks.
Thanks for watching our video today on how to do a RockFloss technique on an ankle and a knee. If you like this video, please hit the like button and subscribe to our channel for any future videos on sports medicine. Again, my name is Dr. Brandon Thomas, the founder of Mobility Clinic, and we'll see you next time.